Lung disease is one of the leading causes of disease and death in the United States. The National Emphysema Foundation was established to provide education and patient care in the management and treatment of obstructive lung diseases. I'm Dr. Richard Imbruce, and I'm here to talk about the partnership that nursing and respiratory therapy provide in managing and treating lung diseases. Nursing and respiratory therapy have worked together for the past 40 years in all areas of the hospital, the intensive care units, the critical care units, cardiac care units, neonatal intensive care units, pediatric intensive care units, in labor, delivery, in a nursery, medical and surgical units in pediatrics, in psychiatry and recovery rooms, and emergency rooms, and in rehab, and in long-term care treatment centers. The emergence of respiratory therapy has resulted in the advances in technology to help patients get well in ways that were impossible years ago. Respiratory therapists work with sophisticated medical equipment, like mechanical ventilators, that breathe for patients and people who can't breathe on their own, and other devices that require a knowledge and love applying science to technology. They're considered the go-to experts in their facilities for respiratory care technology. But their high-tech knowledge isn't just limited to the devices and the operation of these instruments. They also discuss with physicians how to apply these high-tech devices in the care and treatment of patients, and how to assess the patients to ensure the treatments are working properly, and how to make the care changes necessary to arrive at the best outcome for the patient. In adult acute care, they work hand in hand with nursing, managing ventilators, suctioning patients, intubating patients, establishing airways, providing the proper humidification, administering bronchodilator drugs, and other medications. In continuing care and rehabilitation, they implement chest physical therapy and train patients to live with their disease in the most beneficial way. In diagnostics, they do arterial blood gas punctures and analysis. They conduct spirometry, and we'll discuss their diagnostic capabilities. In the field of education, both a baccalaureate and associate degree programs and continuing medical education are provided for respiratory therapists and other allied health professionals who would like to learn about respiratory therapy. In home care, they manage patients at home requiring ventilatory assist devices. In long-term care and skilled nursing facilities, a lot of patients requiring mechanical ventilation are being moved to long-term treatment care facilities where they work, again, in concert with nursing in providing this care. In management, they conduct and administer respiratory therapy services in small, medium, and large hospitals and other major institutions in the United States. They also run home care departments and manage all forms of patient care, both in the home, as ambulatory care, and in long-term care facilities. The area of neonatal intensive care and management of neonates and childhood lung diseases, they are integrally associated with. Small ventilators delivering very small tidal volumes, treating these infants which weigh less than 2 to 3 kilograms, and in sleep areas, sleep medicine, obstructive sleep apnea, managing sleep labs, making the diagnosis, implementing the instrumentation to do sleep studies, and then providing the therapeutic advances in the treatment of sleep disorders. In air and ground support, respiratory therapists work in concert with the EMTs in providing resuscitative as well as ventilatory techniques and therapies in fixed-wing aircraft and helicopters, at accident scenes. And in disaster recovery, the SARS and avian flu epidemics highlight the importance of providing respiratory care and ventilator support for airborne contaminants.